The last flights in from South Africa arriving into Heathrow this morning. As of noon, direct travel from the country and 5 others in the southern African region has been suspended. Perhaps conscious of the heavy criticism the government has faced for not acting quickly enough on COVID in the past, the Health Secretary emphasised the need for a speedy response.
We are concerned that this new variant may pose substantial risk to public health.
Omicron has been described by scientists as the worst variant so far. Linked to a surge of cases in the Gauteng province of South Africa, it's heavily mutated, which is worrying because it could mean the virus is able to evade the body's immune system and transmit faster.
We also need to understand how fast it grows in South Africa, where they're seeing many cases at the moment. South Africa are reporting rapid rises in cases and a very high transmission rate, with an R value reported in Gauteng of almost 2, which is much higher than we've seen around the world for quite some time. All of that is concerning.
Last Saturday, rugby fans from South Africa cheered on their team playing England. We know major sports events have been responsible for high transmission before, although all attendees at Twickenham did have to have proof of vaccination or a negative test. The EU has now imposed a travel ban from southern Africa too, yet Belgium has already detected a first case in someone who's travelled from Egypt. So are travel restrictions the answer or unfair?
That kind of reaction is quite knee-jerk and
South Africa's health minister says they're unjustified and his country is being scapegoated. A condemnation shared by the African Centre for Disease Control. And here's a sobering contrast of stats. In Europe, 62% of people have been vaccinated. Across Africa, it's just 10%.
I think we've been saying this for a very, very long time, and perhaps the world hasn't listened to us, and perhaps will listen to us now. We can't leave a single region of the world without high vaccination coverage. And for a long time, we weren't able to give vaccine supplies to many countries in the African region. Low vaccination coverage will allow the emergence of variants. And even with border closures, I think we all know that these variants will find a way of spreading worldwide.
Experts say it'll be weeks before we have exact detail on the Omicron variant. Its detection has already had huge implications on thousands, especially those who had travel plans to or from southern Africa. And if the worst fears should be realised, can further COVID restrictions be imposed? England's Chief Medical Officer Chris Whitty said today his greatest worry is 2 years in, people may no longer accept them.
Well, joining me now from Johannesburg is vaccinologist Professor Shabir Mahdi, who led the clinical study for the AstraZeneca COVID-19 vaccine in South Africa. Professor, thanks very much for joining us this evening. It is being talked about as the worst variant so far. Is that how you describe it?
Good evening. So theoretically, it would appear to be a variant with more mutations than what was observed in the past, including mutations that possibly makes the virus relatively less sensitive to antibody that's induced, either by past infection or by some vaccines, as well as possibly make the virus more transmissible. But these are theoretical concerns. In fact, in July of this year in South Africa, there was another variant that was known as a C12 variant, which was sort of a chimeric of the beta and the delta variant. And that variant was also sort of quite prominent for a brief period of time and pretty much fizzled out. So I think, yes, it is important to keep an eye, and particularly to see what the theoretical concerns are, how it actually evolves in terms of its clinical relevance. But right now it's premature to make any sort of a call as to whether this variant is going to outcompete the Delta variant, whether indeed clinically it is more transmissible, as well as whether it's relatively resistant to antibody activity. But I think we also need to be clear that resistance to antibody activity doesn't necessarily infer complete resistance to vaccines. Vaccines still do a fabulous job, including the AstraZeneca vaccine, which didn't protect against the beta variant when it came to infections and mild disease. The AstraZeneca vaccine still had more than 80% protection against severe disease due to the beta variant. And that is because there's another arm of the immune system that is relatively conserved when you have these mutations that are predominantly affecting the spike protein, as that is a T-cell immunity. And much of the prevention of severe disease is probably more dependent on the T-cell immunity rather than its mutations which more affect the antibody activity against the virus.
So, I mean, you're saying that it's premature to make too many guesses about how difficult this virus will be to tackle, but the rest of the world is moving quickly. The UK has banned flights from South Africa and 5 other countries in Africa. We've just heard that Canada has said foreign nationals who travel through South Africa will need to quarantine. Is that right? Is that the right thing for the rest of the world to start doing?
Well, I think it's naive for any other country to believe that by imposing restrictions on a handful of countries that you're going to prevent the importation of the variant. The amount of traffic that occurs between South Africa and India, as an example, all it takes is a few travelers to go to India to meet with extended family who move on to travel to the United Kingdom. The past 2 years should have taught us one thing, and that is this virus is able to penetrate and is able to disperse across the globe, irrespective of the type of restrictions that you put into place. Unless you're an island nation such as New Zealand that literally shuts itself off from the rest of the world, the chances of being able to prevent the importation of this virus into the United Kingdom, in any other country, is nominal. It hasn't happened in the past. It's not going to work this time around, as we already see the variant has already been identified in Israel, in Belgium, in Hong Kong. So it would be foolish to believe and naive to believe that by shutting down travel for a handful of countries, that somehow you're going to change the legacy of what's happened in the past 2 years and prevent an importation of the variant.
So Canada banning entry to foreign nationals who travel through Southern Africa is naive. What should we all be doing?
So we need to be measured in the manner in which we actually go about dealing with this. And yes, there needs to be some sort of measured approach to travelers, including that people should be vaccinated. If they're not vaccinated, they shouldn't be allowed to travel. In addition to which, you can make it a prerequisite that people have a rapid antigen test done at a time when they come to the airport before they travel to another country. That is a much more measured approach than believing that you're going to prevent importation of a virus, which has been highly successful in disseminating across the world repeatedly for different variants.
So when you talk about vaccination being key, only a quarter of the population of South Africa are fully vaccinated. I mean, is that partly a problem of countries which we know at the beginning, were accused of hoarding vaccines? Is that partly, where this was always going to end?
Absolutely. The more virus there is circulating in countries, the more likely you're going to get this sort of mutations occurring. And unfortunately, in some countries where there's a fair percentage of people that are immunocompromised, those countries, unfortunately, will result in variants evolving, similar to what we've seen now. So the hoarding of vaccines by high-income countries certainly is a contributing factor, but I wouldn't say that's the factor. The reality is that this virus is going to continue mutating with or without vaccines, more likely, more rapidly without vaccines than with vaccines. So vaccines are important, but it's not going to bring an end to the mutations that are occurring and the evolution of future variants, including variants that truly might become resistant to vaccines, and that might not necessarily happen in South Africa or in Africa. Those type of things might well end up happening in the United Kingdom itself. The Alpha variant, remember, was originated in the United Kingdom.
Professor, we're going to have to leave it there, but thank you so much for joining us this evening. Thank you.
Thanks.